So the first thing I'm going to do is do hand hygiene and put on clean gloves. I'm going to raise the bed to a good height and put down this side rail.
Yeah, because you have to.
I'm going to put a waterproof chuck or like a waterproof mat down so that I can keep the bed dry. My patient is going to be lying on his left side because that's the way the bowel goes, and he's going to be in Sims position, so his right leg is going to be up. I'm going to explain the procedure to my patient, and to start, I'm going to fill my bag according to the directions. So I have 500 milliliters of water in here, and I put my solution.
Okay, so
And to mix my solution, I'm just going to kind of work the
So
back
first
like
thing I'm going
this.
to do is hand hygiene
Not
whenever
shake it
I walk into the
violently.
room. Introduce myself to the patient.
So then
Explain to
I
them how the
am
procedure is
going
going to go,
to
what to
insert
expect,
my
things to look for,
enema
and then
3
you'll
to
raise
4
the bed
inches.
to a
So I'm
comfortable
going to take the
working
cap
height.
off and make sure that this is lubricated. Make sure there's enough lube so that it's not uncomfortable. And I'm going to insert this arm bar down about
Make sure you have a bed pan
3
close,
to
just in case
4
the patient
inches,
cannot retain
and
the
then I
fluid from
am
the enema.
going to lower this to their hip, like
want
hip
to
patient's hip
on the
level.
left side,
So about right here,
Sims position.
I'm going to unclamp it, and then I'm going to start slowly administering the enema. As it starts going in, I can kind of lift my bag higher, and then just based on how the patient is feeling, will determine how
Make sure you have your
fast or how slow that this goes in. If they start cramping or feeling very uncomfortable, then I will lower it or even clamp it off to give them a break. And then once it is all administered, I'm going to take it out, my cap back on, and I'm going to clean up my patient's area and make sure they're all clean. Get rid of all of my wet stuff. So now my patient has to retain the enema. If they cannot retain it by themselves, then I'm going to put them on a bedpan, just like this, and help them turn over on the bedpan, like that.
Don't ever shake it. Hang it back up.
Then I'm going to put my side rail back up,
Put your water
and put my bed back down, and dispose of my enema.